Bismillahirrahmanirrahim. The development of kidney involves three kidney systems. Number one is pronephros, number two is mesonephros, and the third one and the last one is metanephros. Metanephros is a topic of discussion in this illustration video. Metanephros are the definitive and the permanent kidneys. Metanephros began to develop early in the 5th week. Early in the 5th week is the time when the mesonephros are regressing massively. Metanephros begin to function in the end of 9th week, and the end of 9th week is the time when mesonephros have regressed totally. So it takes about 5 weeks for the metanephros to develop. These are some of very important points about the timeline of metanephros. Metanephros have two functional components. The number one is the collecting portion, and the number two is the excretory portion. And very important information related to these two portions is these two portions derive from two different sources of intermediate mesoderm. Two different sources of mesoderm forms these two portions of metanephros. So I tell you, the collecting portion is derived from metanephric diverticulum, and the excretory portion is derived from metanephrogenic blastema. This blastema is actually a mass of mesenchyma, so it is also called metanephrogenic mesenchyma. Okay, now let's see from where these two components comes from. This is a metanephrogenic blastema, and it is derived from the caudal part of nephrogenic cord. And please see, this is a ureteric bud, and it is actually an outgrowth from the mesonephric duct. From the mesonephric duct near its entrance into the cloaca. So this is the ureteric blood, and this is its origination. The formation of metanephros begins in the 5th week, when the ureteric bud sprouts from the distal part of mesonephric duct. This is the first event in the formation of metanephros. About 4 days after this event, the ureteric bud penetrates the blastemal tissue. After penetration, it bifurcates. And each branch dilates at its end. This dilated end of each branch is known as ampulla. Each ampulla acquires a cap-like aggregate of metanephric mesenchyma or blastemal tissue. And this configuration, that each branch has a dilated end and that dilated end acquires a cap-like tissue of mesenchyma, makes the shape of metanephros a bilobed structure. This configuration makes the metanephros a bilobed structure. So the metanephros have bilobed appearance at this point of development. And each branch of the ureteric blood divides further and further. This further branching of the ureteric bud with metanephric mesenchyma at its dilated tip results in a lobulated appearance of the metanephros. So the lobulated appearance of the metanephros is due to these facts. This lobulation of the metanephros or the permanent kidneys disappear in infancy, not during the fetal period. Please note, when the baby comes out in this world, his kidneys or her kidneys are lobulated. Okay, this lobulation of the kidneys disappeared during the infancy, and the lobulation disappeared due to number one, elongation of the proximal convoluted tubule and loop of Henle. Number two, this disappearance of lobulation is due to an increment of the interstitial tissue of kidneys. And the point that I want you to appreciate, that the increment of the size of kidneys and disappearance of lobulation of the kidneys is not due to the formation of new nephrons. Nephrogenesis is a thing of fetal period, not a thing after birth. So this is about the disappearance of the lobulation. Now please focus on this part of the diagram, and here I want to tell you that the ureteric bud, when the ureteric bud first contact with the blastemal tissue or the mesenchymal tissue, its tip expands. And this very initial expansion of the tip form an initial ampulla. and this initial ampulla will form renal pelvis in future. Okay, so about the renal pelvis, I have tell you how it forms or how it develops. Now look at this figure. It is a 6th week diagram of kidneys. During the 6th week, the ureteric bud bifurcates 4 times. It bifurcates 4 times. And it results in 4 generations of bifurcations. And these 4 generations of bifurcations results in 16 branches of ureteric bud. These 16 branches are 4 generations of bifurcations coalesces and forms major calyces. So this is the embryology of major calyces, that how it develops. Okay, this is a major calyx and this is a renal pelvis. At this point, I want to tell you a very interesting information, that the word calyx is derived from the word calyx of flower. The calyx in flower is actually a sepal. The shape of sepal and the shape of this structure resembles, is similar. Okay, so due to this fact, this structure is called calyx. Okay, now look at this diagram. It is the 7th week diagram, and in the 7th week there is a further branching, and during the 7th week the next 4 generations of branches also coalesces, and when they coalesces they form minor calyces, and you can see this is a minor calyx. Okay, there is a further branching from the minor calyces. The branching continues from the minor calyces, and they bifurcate, further bifurcate until it is 32 weeks. Okay, so you can see this very extensive branching in this diagram. Here are about 11 generations of bifurcation, and these 11 generations of the bifurcation form approximately 1 to 3 million branches. Huge number. Okay, these 1 to 3 million branches are actually the collecting ducts of future kidney. Okay, the collecting ducts of nephrons. Okay, so please note at this point, you can please note at this point, the ureteric bud give rise to number 1, ureter, number 2, renal pelvis, number 3, major and minor calyces, and the last one, 1 to 3 million collecting ducts of nephrons. So the ureteric bud forms 4 structures. Number 1 is ureter, number 2 is renal pelvis, number 3 is minor and major calyces, and the last one is 1 to 3 million collecting ducts of nephrons. Now comes on to the second portion of illustration, that is about the nephrogenesis. Okay, look at this figure. The pink one area in this figure is metanephric mesoderm or mesenchyma, and the nephron originates from this metanephric mesoderm. As I told you earlier in this illustration, each newly formed collecting tubule is covered at its distal end by metanephric tissue cap or mesenchyma. And you can very easily appreciate this fact in this figure. You can very easily appreciate. This is a metanephric tissue cap, and this is a ureteric bud. The ureteric bud proliferates, grows, and secretes growth factors. It secretes growth factors, it secretes cytokines, and it secretes some molecules. These growth factors, molecules, cytokines act on the metanephric mesoderm and causes it to differentiate into nephron. Okay. Similarly, the metanephric mesoderm induces the ureteric bud to differentiate into number 1 collecting duct, number 2 major minor calyces, number 3 renal pelvis, and number 4 ureter. Okay. So there is an induction between the ureteric bud and metanephric mesoderm, and there might be a disturbance or perturbation in these inductive events. Okay. So there might be a perturbation or disturbance in these inductive events, and if there is a perturbation or disturbance in any aspect of these inductive events, the result is number 1, renal hypoplasia or agenesis of kidneys. Okay, or it might result in a duplication or overproliferation of the structures, like the duplication of ureter. Okay, the renal hypoplasia or the renal agenesis is due to the loss of function of these inductive factors, and the duplication of the overproliferation of these structures is due to the gain of function of these inductive factors. So these inductive factors and these inductive events are very much important in the development of permanent kidneys. Okay, let's elaborate the genesis of nephron step by step. This is actually the last portion of this illustration. So please be attentive and remain with me with your whole attention. In this figure, you can see each newly formed collecting tubule is covered at its distal end by a metanephric tissue cap. This metanephric tissue cap differentiates into a small vesicle. This small vesicle is known as renal vesicle. This small renal vesicle gives rise to a small S-shaped tubule. The end of this, one end of this small S-shaped tubule expands and form a cup-like structure that is known as Bowman capsule. And the Bowman capsule acquires a tuft of capillaries which will form glomerulus in future. The other end of this small S-shaped tubule join the collecting duct, and the lumen of the collecting duct and the lumen of this small S-shaped tubule becomes continuous. This is an important event in the formation of nephron. The further development in the nephron is the elongation of the tubule. The elongation of the tubule will form proximal convoluted tubule, loop of Henle, distal convoluted tubule. And this is a final figure of nephron. You can see how it finally looks like. Okay. The formation of nephron continues until it is a birth, and approximately 1 million nephrons are formed in each kidney. 1 million nephron in this kidney and 1 million nephron in this kidney. As I told you, nephrogenesis continues until it is birth. Then there is a question: how the kidneys increase in size after birth when there is no nephrogenesis? The answer is the elongation of the proximal convoluted tubule and loop of Henle. Number 2 is the increment of the interstitial tissue will cause the kidney to increase in size. Okay, and at the end of this illustration, let's have a brief description of the function of kidneys. Okay, the function of kidney is urine production. Very simple, urine production. And this urine production starts about by the 10th week. And please keep in mind, excretion of metabolic waste is not a function of fetal kidney. Well, it's the function of adult kidney or a kidney after birth, but it is not a function of fetal kidney, because this function of excretion of metabolic waste is done by placenta. Okay. Kidneys start to excrete metabolic waste when they are mature and when they have an increasing rate of filtration. And this maturation and increasing rate of filtration is acquired after birth.